Hi, my name is Duval. I'm a doctor of physical therapy, and today I'm going to walk you through a couple stretches for ankle mobility. The first stretch that I want to talk about is a stretch for ankle dorsiflexion. Ankle dorsiflexion is this motion when your toes come up towards your knee. It's very important to have good ankle dorsiflexion because if you don't, when you're walking, you might stub your toe as you're trying to pull your leg through. So very, very important that we make sure to have at least 10 degrees of ankle dorsiflexion. I like to see closer to 20, but 10 as a minimum. Okay, so stretch for ankle dorsiflexion. You'll take your affected ankle, whichever one you're stretching, and just step that leg forwards, kind of like I'm doing right now. If you're on a hard surface like I am, you might even choose to take like a washcloth or a towel and place it under your back knee, just so it's a little bit more comfortable on your knee. Okay, now once you have this position, you'll interlace your hands and place your palms on top of your thigh. Make sure that your knee is tracking directly over your toes. Then slowly press your knee forwards. Try to get it as far as you can comfortably, of course, never pushing into pain. Make sure that your heel does not pop up. So goal here is to keep your heel down on the ground and to press your knee forwards just as far as you can comfortably. You might feel a little bit of a stretch. You should not feel any sharp pain. Now from here, you can actually change the angle of your knee. So to start, you're just gonna go straight forwards. However, you can also take your knee in a little bit and then out to the side and get all the different areas in that joint that might be restricted. So as you can see, I'm moving my knee around, going more towards the pinky toe edge, then more towards the big toe edge. All right, now there's another variation of this exercise. If this isn't comfortable or if you really can't put weight on your back knee, you can stand up and go to a wall. I'm now going to be demonstrating the exercise with my left leg, so I'm switching legs here. You'll point your toes directly towards the wall, and then same idea, place your hands on the wall and bend your knee so that it slowly tracks over your toe. All right, now the further away your foot is from the wall, the harder this is going to be because it's going to be harder to get your knee to the wall. If you put your foot really close to the wall, you'll probably be able to tap your knee to the wall, no problem. I don't really care if your foot is close to the wall or far away. What's more important is that you get a nice pain-free stretch in your foot and ankle as you do this. All right, so you'll repeat this 2 to 3 sets of 8 to 12 reps, just finding your edge, pain-free edge, so that you can increase your foot and ankle dorsiflexion mobility. Okay, so we talked about dorsiflexion. Next, we are going to move on to plantarflexion. That is the pointing of your foot. Plantarflexion is also important for your walking, for your gait cycle, because you need a good plantar flexion range of motion to push off from your toes when you're walking, right? So if I step through and I can't plantar flex, it's gonna look more like this. If I have good plantar flexion, I have a nice push off preparing for the next step. So to stretch the plantar flexion range of motion in the foot and ankle, you'll come onto your hands and knees. Again, you can always put a towel under your knees if this is uncomfortable. You'll untuck your toes and just put your feet flat on the ground like mine are right now. Now, you might already feel a pretty big stretch right here. If you already do, you don't need to go backwards anymore. But if you don't quite feel the stretch, you can slowly begin to walk your hands back towards your knees, maybe even dropping your glutes down onto your heels. You might even walk your hands all the way up onto your thighs if that feels okay. Remember, never push into pain. This should be a nice, gentle stretch. All right, now here's a variation on the plantar flexion stretch, because as you probably noticed when you walk, your toes aren't pointed in this direction, they're tucked under. You can shift your weight forwards, tuck your toes under, and then drop your heels back. This is stretching your toes into extension, which is also very important for the gait cycle. If your toes can't extend, it's really hard to get that nice push off that I just demonstrated, right? So I'll demonstrate again. If I'm walking and I can't extend through my toes, I'm really never gonna be able to get into that full plantar flex position that I need to take the next step, right? So this is a great way to stretch your toes if you do have some tightness and stiffness in that region. Same idea as the plantar flexion stretch. Just drop your glutes back as far as you can comfortably. For more intensity, you can walk your hands up onto your thighs and sit down onto your heels. Okay, so that was dorsiflexion and plantar flexion. We still have inversion and eversion. Now inversion and eversion is a little bit trickier to get that mobility, but I have a good method with a washcloth. You'll place the washcloth down on the ground. on your knees to start with a pad under your knee if you need. Place the ankle that you're trying to stretch right onto that washcloth. Now I like to interlace my hands and place them on top of my thigh because it keeps me from moving my knee. What I'm going to ask you to do is swish your washcloth back and forth. Imagine as though your heel is drilled down into the ground. So that is your fulcrum right there, is the heel. You're rotating around it. You're not moving your knee, right? If you move your knee, the motion is happening up here at the knee and the hip, not at the ankle. So make sure that you keep your knee super still and you gently move side to side. Now you notice as you pull your foot into inversion right here, the outside edge of the foot presses down into the washcloth and the inside edge picks up. As you press your foot into eversion right here, the inside edge of your foot presses into the ground and the outside edge picks up. So back and forth, rotating that foot from side to side. If this is uncomfortable, you can also do it from a standing position. Same principle applies, just make sure that you do not move that knee at all. It's a little trickier in a standing position because you can't put your hands on the knee to keep it still, but that's okay. It's a little bit more advanced, but I know that you can do it. This is even more functional because most of the time when you're moving your foot and ankle like this, you're standing up anyways. Okay, so that is stretching into dorsiflexion, plantar flexion, inversion, and eversion. Thank you for watching.